Hello, everybody. Michelle and Nicole from Maxill, your IPAC specialist. Maxill is thinking about customers in this time of changes with the pandemic, and we have brought together a COVID resource landing page on our website, and we thought we should share it with you so you know where to navigate, where to get the information, so you can download it for your office resources and have handy for your practices. So we shall start. So if you come on over to the Maxill tab, we see, of course, a couple choices here. We're going to head over to COVID resources. You can have a bit of information about COVID Express for shipping and for your orders. And over here, COVID resources is how we got to this landing screen. As you navigate down, it gives you a little bit of information as to what Maxill offers in products to be compliant. So, at a quick glance, instead of using the search engine for any of these topics, if it is something that is related to COVID or IPAC, you can come directly here, click on any of the icons, and it'll bring you exactly where you need to go. So over on the bottom, we have also been busy writing some blog articles and having some upcoming events. So this will be where you'll be posted for more information. And between Nicole and I, we're going to be having a little bit more additions here to our calendar, so you have more education coming your way. Over onto this margin is really where we want to show you some information. We're going to begin here with the resources. We have a dental office re-entry into practice, donning of your PPE with additional precautions, doffing of the PPE with additional precautions, a hand washing poster. Then we've taken the step further and divided your standards based on provincial resources. Between Nicole and I, we're very busy in trying to figure out from province to province, as customers call in, what are the standards obviously for your specific geographical area. So we have gone province to province in this list, so you can basically go into the area, we'll show you here, and then it's a drop-down menu. So then you're able to see what's available based on that province, divided into what does the government give us, what does the dental department of overall dentistry give us for management of IPAC, dental hygiene regulations, denturists. So we'll go back. We have government-based, which could be public health documents in here as well, for the dentist, for the hygienist, for the denturist. And whether I'm going into the province of Ontario, let's click onto British Columbia, the same thing. Now you will find when you go in that there's different titles depending on your province. So in Ontario, we don't have dental therapists, but we have some in British Columbia. In British Columbia here, you'll see the title for dental assistants, as they have their own guidelines. So it is very specific to that geographical area. So once again, when you're trying to get information and you need it ASAP, well, we feel very confident that this is a good tool for you, that you'll be able to find that information offhand. So let's go into dental office re-entry into practice. Now, some of you have already re-entered the practice. Some of you are just coming back. And some of you perhaps will be coming back to a different type of practice as the provinces move between either stage 1, stage 2, stage 3. So we can kind of be everywhere within those stages at this point. But we know that somehow we have to look at the whole title practice and make sure that we are following the standards.
It's good to be proactive. We also have an IPAC live chat. So if you have questions or comments or just need help in general, we do have a 24-hour service on our website for IPAC Chat that someone can quickly and easily answer your questions for you.
Excellent. And I think that's a big help, because in the moment when you're not sure, and it's never going to be when you have the luxury of time, it's always going to be when you're super busy and you need to find out that information. It could also be when there's challenges that are presenting during your busy workday and you need that data. And a little bit about what we do at Maxill for the IPAC Chat. It is ran actually a team of 3 at the moment with myself, Nicole, and one of our wonderful, I'm going to call her our IT, our technician. So she helps Nicole and I in the computer portion that maybe we are not so skilled at. The importance of having help is, as we said earlier, your questions will be answered. So should you come up with a scenario that you're in that you need support, whether it is based on IPAC theory or product, Now, the nice thing is that Nicole is available as well to come to your practice 5 days a week, not 7 days a week, although we have been doing that. So yes, it is known that we can come to your office as well Saturdays and Sundays. But yes, so within the regular business hours, Nicole is available pretty much at any time to come to your office. So that's another nice thing to know, that although you have the support of the IPAC chat at any given time, if you need a real person,
I'd be happy to help you out.
There are real people here to help you. So let's pretend that you're needing to use this dental office reentry practice, whether you're coming in, as we said earlier, brand new, or you've already been into practice and you're wanting to know, am I doing things correctly? A lot of the phone calls, a lot of the IPAC chats that Nicole and I receive is basically, have I done everything I can do? A lot of the information is making sure that you are where you need to be at wherever the stages are. And of course, too, from an inventory perspective, that you have what you need. And PPE has been interesting for all of us. So in our first category for inventory, in kind of going over the whole overview, we obviously need that, we know we need our whole PPE, but we know what the highlights are. So now we're looking at respirator masks, right? Do we have the N95s? Do we have a KN95 that has been passed by Health Canada? The gowns are a big one. Nicole and I spent quite some time researching the level of gowns.
Right. You need the documentation for what level your gown is that you're going to be using per treatment.
Exactly. And then gone are the days that we are just wearing whatever PPE is in the office. We do need to make the decision based on what the procedure is. And everybody by now has heard the terms aerosol generating procedures, non-aerosol generating procedures. And that is really what's going to be your pivotal decision as to what we're wearing. So gowns, obviously our usual mask, our surgical mask, level 1, level 2, level 3. We will often get the question here, Nicole and I, the different levels of masks, what they do, and Maxill does not offer a level 1 mask, as we feel that that's not enough protection, right?
No, it doesn't offer the filtration that you need.
Exactly. So we offer you a level 2 and a level 3, and again, based on inventory and shortage of PPE, we are certainly trying to do our best to have that available to dental offices. Nothing much has changed for gloves, nothing much has changed for eyewear, face shields. If you weren't used to wearing face shields, obviously they've come into the picture as well. And we've got plastic barriers, rubber dam we were always using. And one of the newest things is the pre-procedural rinse. Yeah, so the hydrogen peroxide, and what the theory is, and if we recall, we're gonna step back a little bit when the pandemic started. There was a lot of information going on, and H2O2 was one of them, where was that a valid choice for a mouthwash? Then it was, no, it isn't. Then it came back to yes. So it was kind of going back and forth. But the concept is that the hydrogen peroxide, if we were to look at the coronavirus, under a microscope, the outer shell is not a protein layer. It's a lipid layer. So it can actually be dissolved very quickly. And if you're using something that's very oxidized, like hydrogen peroxide, that'll offer that extra step of prevention. Nicole has been very busy giving out directions on how to dilute hydrogen peroxide. And when you purchase it, it's usually 3%. And then obviously you're trying to reduce that ratio so that you're down to 1%, simply mixed with water. It could be tap water, it could be a distilled water as well, right? So now for staffing and training, and a couple of things there too that we can look at. And I'm gonna let Nicole take this one over for some of the wonderful new things you may not be aware that Maxill has that will assist you with staffing and training.
So we had a lot of inquiries on a lot of offices wanting help with regards to seeing if their office was IPAC compliant. They really didn't know where to begin, as with it changes day to day, hour by hour. So we designed a couple of IPAC products. The first one is called IPAC in a Box. And pretty much what it is IPAC in a box. It's everything that you would need for an office. From example, me coming in to do a complete review of your office from reception into your sterile bay, into your ops, into your lunchroom, into your lab, going really into your personal space, into your drawers to make sure that you're following, the IPAC guidelines. No different than public health coming in, but just a nicer person to come in. We also offer IPAC theory with all the logs, all the documentation you would need to make sure that your mechanical and chemical logging is up to date. I stress not enough that the logging is really important. We also offer a complete customized IPAC manual specific to all of your office policies and procedures. So I can come in and help customize everything that you would need to be IPAC compliant. We do have on our website a link, a drop-down box specifically to IPAC. And again, it comes down to if you have questions or concerns, there is a live chat, or you can contact myself through the 1-800 number, and I'd be happy to help you out.
And as Nicole was saying, the written policies is so important because we've all learned, not so much that we've learned this attached to IPAC, but to record keeping. If it's not written, it didn't happen. And we've been busy, not just now because of the pandemic, but it's a service that maxill has offered now for about 3 years, 3.5 years, almost 4 years, where we do go into offices and offer you what we call a mock IPAC audit, but it is real. We are real people coming in to help you. And it is very interesting because sometimes when you're in the moment in your own practices, you may not realize the things that we don't have in a practice, or you have somebody coming in looking at it from a fresh set of eyes as to things that could be improved in your practice. With the written policies, what we also find very interesting is that writing a manual is no simple task. So we had said originally that our team for Nicole and I also consists of a wonderful computer expert, we're going to say, and that helps us with writing manuals. When a lot of times when we step into offices, people think they have a manual, but what they really do have is only the appendix of the manual. So it has to be specific to your practice. And it can take, well, it can range when we come into your practice to help you write the manual. We call it the extraction data list, where we grab information from your practice, and sometimes we're there an hour to
up to half a day.
Yeah, half a day. Or Nicole can become your new best friend and you have her coming in for 3 days. It all depends on the size of your practice and what your needs are. So we're very proud to be able to offer our Maxill 360, and we'll be showing you the drop-down menu very shortly as to how we can help you. We're busy in dental offices, and we get it that by the time you were to sit down to start writing an IPAC manual, either you're doing it between clients, your next client is there,
right,
or are you bringing the information home and are you doing this all at home? But whatever manner you be doing it, there's always a stop and go. And that's where the task becomes, well, a little cumbersome, non-enjoyable. And it could also be that somebody in the office is voluntold that they're doing this task. They may not want the task. So yeah, leave it to Nicole and I so we can come in and help you and ensure that you have all the sections you need, including a pandemic section. So we were very diligent in doing our research as to what the latest information was. We also did not bring out information at the beginning of the pandemic because it kept on changing. And Nicole and I had many discussions on, well, do we do a webinar now? How about now? How about now? No, because every time we would decide to do something again, had changed. So I think that's an important thing as well, is that as we keep up with the information, that we realize how quickly that information is coming towards us and how quickly it's changing. So now we move onto our list. So we're still on the dental office reentry into practice. We're looking now at number 4, technology. And that really is not much to do with Nicole and I helping you here, but making sure obviously that everything you're using for technology is working. Are your computers working? Is your connection between the monitors or the desks and the operatories able to connect to the Panorex? Can you print? Is your debit machine working? Is your intraoral camera working? Obviously, we've had some of this equipment off for some time, so we have to make sure that it's up and running. And to feature up and coming sometime in the fall, as everybody moves to virtual learning, you will have the wonderful opportunity for Nicole to teach this great webinar that she's been working on equipment maintenance.
Yes.
I'll let you explain a bit about that.
So I've put a nice package together for you for a webinar on equipment maintenance. So it's not just the bare bones that we try and do every day between patients. It's things that need to be done on a day-to-day, week-to-week, month-to-month basis with a lot of logging. So it gives you insight as to what you need to fix before you end up having to cancel the whole afternoon because something's gone wrong with your section. It's tools and tricks of the trade that will help you have ease of mind throughout your day-to-day practice.
And Nicole's really thought of you on how busy everybody is. Along with it is a series of logs so that you know what you need to do for each piece of equipment that's in your office and navigating you through how you would actually come up with the system. So we'll keep on going. Number 5, dental unit water lines. And our catchphrase between Nicole and I for dental unit water lines is that they are not an event, they're a process. Because there's a lot of information, and I'm going to say there's a lot of misinformation where we kind of have to connect the dots ourselves, and that's a little bit difficult when it comes to something as serious as dental unit water lines. So really we need to look at the equation as being that we clean, disinfect, and test. When we first started at maxill with the dental unit water line system, our H2O will be showing up very shortly. We kind of, I'm going to maybe want to say that we missed the one equation where we were not telling people that it's not as simple as clean, disinfect, and test. That'd be great if your water lines had no biofilm. So, and that could potentially work, right, for the offices that don't have much biofilm or offices that previously had a system in place. But if you have not had a system in place, or depending on the water flow, depending on that biofilm matrix, you may be parked at clean and disinfect, and then back to shocking, or back to testing. So you may need a couple of, also known disinfection or shocking, a couple of shocks back to back before you get to that testing that you're pleased with.
Especially now have closed, many offices closed for many weeks, if not months now for the past little bit. It's a great opportunity to make sure that your dental unit lines will pass colical forming units for testing. So you can't just do the bare minimum. It is a clean, a disinfect, and see where we are for testing.
And when we go back to the manufacturer's instructions for use, so whether your equipment is ADEC, Buffalo, Pelton, Crane, if we read the fine print, they've all said, if your equipment has, obviously, the closed bottle system, that you have to come up with a system, a dental unit water line maintenance system. Some will give a little more direction, some will give some types of products to use as well, but then it's kind of left to you to figure out your own system. Then if we head to the regulatory bodies, again, the same thing is repeated, that you need to refer to the manufacturer's instructions for use for the actual instructions on what to do. So the other nice thing about the service that we offer for the IPAC 360 for the writing of the policies and procedures is there's a whole segment on dental unit water lines. So when we go in for the assessment of your practice, it won't be just for the sake of finishing a manual. It'll be to make sure that what's written in your manual actually does match what you're doing. So now let's go down to our suction lines, kind of falls under equipment maintenance as well. And for our suction lines, well, pretty simple, right?
Yes.
So we know that we need to clean them. We need an enzymatic cleaner, and it is mentioned in many documentations that the suction enzyme solution container, we're going to say, should be one that has a turbulent action. So something that gives a nice push back into the suction line. And maxill does have one called a Max Blast. And it basically looks like a big jug with attachments, and it works nicely, doesn't it?
Yes, it does. It allows you to have the control of making sure that both the slow volume and the high volume get the right amount of control and the right amount of solution to flush any debris that might be sitting there to help prevent backflow. That's the whole big goal right now, is to prevent backflow.
And we're going to be using our high volume evacuation more than we ever have been, because if we're moving on to aerosol generating procedures, yes, we need the HVE, absolutely. So let's move on to air quality and aerosols. Oh, the hot topic, right? So for air quality, it's been interesting because could we say that dentistry flew under the radar? Perhaps. It was one of the puzzle pieces that was actually mentioned many years ago, even in the public health documents. But we were also busy trying to figure out every other system. We were focusing on other things. So the air quality, it does make sense. If we are in a room that has aerosols, we have to now be accountable and responsible that the air changes have happened in an efficient manner, we could say, to clear the air for the next person coming in. So you are very busy as dental professionals. I don't know if there's a dental professional / HVAC person out there, but we certainly need an HVAC technician to come in and do some testing. We need the number of air changes per hour, and those air changes per hour can be figured out just as your office is now in each operatory based on the square footage. And it could also be so that the HVAC technician gives you a snapshot of what if you add a HEPA filter, could be a 300 unit machine, a 400 unit, but how does that change the air changes per hour? Then you take that number and you head over to right here, we've got the link. The Center for Disease Control, Table 3 fallow times. Kind of a new term that we've been getting a lot of questions on fallow times. So luckily, CDC has done the homework for us and will be directing you exactly to this table. So it does require air quality, a couple people. It does require the HVAC technician, requires to go to your table and find out obviously what the information is. And it does make sense. And I think from a client transparency, people are happy to hear that dental offices have actually taken that whole step forward. So they feel safe. They feel safe coming into the practices. And a lot of offices have mentioned that to Nicole and I, that after doing all that, being worried that their operatories looked a little bit different with the plastic walls or the zippered tents, right? As you're taking your client camping into the operatory, that they've noticed those changes and that they've equated and paralleled that to you keeping them safe. So I think that's important.
And no longer can we go, unfortunately, back to the good old days, if you want to call it that, where it's back-to-back patients. We really have to be cautious of the aerosol general producing procedures and do the fallow times and make sure that you're working with your front desk team to all work together to make sure that there is enough time between patients. Everybody's doing their due diligence to do as best as we can for all of our patients and our staff.
And that's a good point because it does change the schedule. So in the past, and maybe somebody comes to the office and they're a few minutes late, we could still see them in the past. Now I think that's going to be a little bit harder because we have to account for that fallow time. So if your operatory, let's pretend, has a fallow time of 15 minutes, the client is late 15 minutes, that has taken up the entire fallow time. So there'll have to be some good communication, some good teamwork between admin and obviously clinical as well. So then let's move on over to more on air quality. We will be using, we already said, our high volume evacuation, rubber dam, our pre-procedural rinse, and then obviously making our decisions based on whatever the outcomes were from our air quality testing. Sterilizers. Not much new on sterilizers, right?
Not much new.
We were already doing wonderfully, obviously using our sterilizers. I guess the biggest thing was in re-entry into practice, we may not have known that we had to requalify our sterilizers. So in the requalification of the sterilizers, we must prove that our sterilizer is fit to reopen. And that requires 3 consecutive BIs in a PCD, which also needs a chemical indicator, a type 5 in a PCD. And that would be with your regular steam autoclave. If you have a pre-vacuumed, that includes the same, the BI, the CI, 3 consecutive. Also though, the BI, air detection, so the type 2 chemical indicator with the PCD, better known as the Bowie, Dick, and Dart test. We'll be continuing to follow our manufacturer's instructions for use, and now will be a better time than ever to gather manufacturer's instructions for use. And Nicole and I get a little bit of a chuckle out of that term because that keeps head office here at maxill extremely busy.
It does. Yes. It's part of IPAC 360. We do that task for you. We research all of your equipment, all of your instruments to make sure that you have all the manufacturer's instructions for use for everything, whether you order from maxill directly product or if you have outside sources, say Henry Schein or Patterson, we'd be happy to help you make sure that you have all your MIFUs for everything you use.
And I think that's important as a service, and it's ongoing. So we also have something called Platinum, Maxill's Platinum Plan, which we will keep gathering your manufacturer's instructions for you. And all you would do is let Nicole and I know that perhaps you have a new sterilizer. Perfect, and we can help you set up the manufacturer's instructions for you. So basically we have collected a beautiful digital library of manufacturer's instructions for use. And I think that's a big component from time management. It's difficult to gather all those, especially for equipment that is older or equipment we've had for a while. It's simple. If you were to say start now, all new orders coming into the office, well then of course we would have the communication with whomever unpacks the orders to keep all those little inserts that we used to throw out. So we certainly do need them. So from the sterilizer's perspective, yes, we need to make sure our machines are functioning, we test them, but we also need to know the temperature, pressure, and time of sterilization for anything that is reusable.
And all of our logs for your help for the sterilizer are on our website too. So if any of you have any questions or concerns, please reach out to us. We're here to help.
And that makes a difference too, knowing that you've got the logs in place.
Right.
And you can also manipulate your logs. So if there's something that you dislike or doesn't match your office, then please let us know, because we can certainly help you with those logs. So number 9, IPAC overview. We've talked about the manufacturer's instructions for use already in number 8. We will move down to number 10. So quality assurance testing. So we've been doing well, I believe, in dentistry. We know now that quality assurance testing involves mechanical, chemical, biological. We do our sterilization tests. And of course, the topic of the process challenging device. The process challenging device, there's different types. There is the batch monitoring, and you may do that as a commercial PCD, or it could be an in-office made where you put a whole bunch of instruments in one bag, then place your BI, place your CI, that becomes your test pack. So you might have heard it as a test pack. Or you could do the commercial PCD. And one of the questions we often get asked is, are commercial PCDs validated? So Health Canada plays a big role in these, and the batch monitoring PCD is not regulated by Health Canada, but what we put inside the BI and the CI certainly is. Now let's look at another PCD, because the Bowie-Dicken DART test is also called a PCD for air detection for the class 2 or type 2 chemical indicator, which certainly does have to have the testing from Health Canada and the validation as to where it passes in the standards. So what else do we have in our quality assurance testing? We have the soil indicators, and Nicole is sometimes busy at offices setting them up, right?
Yes. It gives you a better peace of mind that your ultrasonic is actually working, or your dishwasher, dental dishwasher is actually working, versus the traditional tinfoil that just pretty much shows you cavitation. Our soil testing gives you more accurate readings for solution, cavitation, time, and temperature. So it is a great asset. And again, it comes with logging to confirm for public health that you are actually testing the effectiveness of your machines.
Which is quite important, absolutely, because we know that in the cleaning phase before you sterilize, if cleaning didn't happen efficiently, effectively, in a quality fashion, then anything that is remaining, gross debris, then that is considered non-sterile. We have radiography that we obviously will be looking at in our own practices, depending on what system you have for quality assurance. Curing lights. That's an interesting one. For curing lights, we should be testing the intensity of that light. And we do have a testing machine available should you need to do that. And then, of course, Nicole already talked about our logging for quality assurance, which are all available on our website there, which is nice. Now, the chemical indicator, well, we have the mechanical, chemical, biological logs. Should you wish to combine all of them in one page, you could do that. Should you wish to have chemical, mechanical together, you still could. And we still offer the BI book. Some people like the little booklet, so you certainly have that as your choices. Client communication, and we've basically talked about that already, that the more transparent we are with our clients, the safer they're going to feel, right? The more welcome they're going to feel. We also have a spot here that we've talked about, maybe putting something on your website, a little message to your clients saying, here's what we've done. And Nicole and I both still practice, and it's been changes. It's been changes for us as well. Every dental office is going to save on heating, because with all the layers of PPE, we're quite warm. So I think as we transition as clinicians within our own practices, that it's important to include the clients, right? And share what our experiences have been and how we've done that, right? And that also means the administrative team. Oftentimes, Nicole and I are asked for training. Does the front desk have to participate in, say, the public health modules, anything to do with IPAC? And they certainly do, because they're probably going to be the first
person they speak to.
Yeah, exactly. So when there's questions, clients could call up and they're going to be speaking to our admin team. So it's nice when everybody certainly is on the same page. Client communication heads right into staff reassurance. And of course, we know of some of the shortages with the personal protective equipment, but I believe that throughout leadership and positive leadership, we can reassure our entire team that we've got this. It's different, right? It's different times. Now, Nicole and I compare our past experience in dentistry, and if anybody worked surgical or anybody did dental assisting in a hospital environment. So the PPE we're wearing now is no different than what you would have worn there. So for some people within the profession, there's not much of a change. For others, having all those layers, it is a big change, right? So nonetheless, so as we navigate through it, team presence is important, and positive leadership to get us through that. Now, as you're using this document, there's also a space here for notes that you are certainly more than welcome to make notes, maybe questions you would have. You could use this yourselves, make notes, and then obviously connect with us and ask the questions that you have. Let's move on back again to COVID resources. We have placed here a new donning and doffing of PPE. We have our original donning and doffing for routine practice that we've all been doing well. And dentistry, I do believe, deserves a pat on the back, as we do understand routine practice quite well, and we have for many years. We've always treated each client as if potentially infectious, and we've always had our choices for personal protective equipment. But now that we're moving into additional precautions in pandemic times, then we need to have our donning and doffing to be a little bit more precise, we can say. And the difference is that there's more hand hygiene moments. So for the putting on of PPE, the donning, we would find our PPE, perform our hand hygiene, then we would put on the right gown. As Nicole was saying, there's different levels for gowns. A surgical mask, if it was required, or do you need an N95 mask? You're putting on your eye protection, your face shield, performing yet another hand hygiene, then putting on your gloves. In the past, in routine practice, there was no number 6. So we know that that has changed a little bit there. Let's go on to the doffing. The doffing has way more steps. So in the past, obviously, we would always do our hand hygiene, safely remove our gloves first, remove our gown, then came the hand hygiene, remove our face shield, but we're performing yet another hand hygiene. Remove the protective eyewear, performing yet another hand hygiene. Removing our surgical mask or N95, performing another hand hygiene. Typically the hand hygiene was closer to the end. So we're adding more hand hygienes, well, for our own protection, right? As we're touching the PPE pieces that we've just used. We have here a hand washing poster. Not much has changed for hand washing. Nicole and I had, I'm going to say, some entertainment in 2019 as we did our Maxill continuing education tour, and we included Maxill's reveal kit, where we were using black light technology and gel, we could say fluorescent gel, and we were having our continuing education lectures with people participating.
Right. Because you'll need a hand hygiene education portion as part of your IPAC training. So we have a reveal kit on our website as well, where you can purchase that and do your hand hygiene education as the IPAC officer right in your own office. And we have provided the logs for you to have that as part of your IPAC training.
And it's quite a nice kit because it's all there. So, and it wasn't new, so it's not really new to the pandemic, as we were doing it way before then, but it gives an activity maybe for the whole office to participate. And Nicole was in an office recently where they took it one step further with the reveal kit, and they went into the operatory with it. And we may think that when we're disinfecting that we're reaching all the surfaces, but
not so much.
No,
a lot of aerosol sprays, like it doesn't get covered. Yeah.
It revealed a lot for a bad joke. So washing our hands, as we have the information here, and also for the disinfection. And I think we have been very compliant with both hand washing and hand disinfecting. Our hand hygiene is certainly there. Now, as we're navigating through, we have talked about gowns and coverings. So we've got different level gowns. And when we head over to the gowns, you will see that we have also some bouffant caps. We have shoe covers, different shields as well, mini shields, and we have the full face shields as well. When we're talking gowns, we have to remember as well that the different levels and how gowns are tested. So your level 1, level 2, 3, and 4, the Government of Ontario and Government of Canada website, CDC, have great explanations on what gowns are. It's also one of our articles on our blog that you can look at what level you need for whether you're producing aerosols or not. Gloves, nothing much has changed. Masks, we've already talked about. We've got our face shields, infrared forehead thermometer, where we're still using for proper screening, our disinfectants, our hand sanitizers, soaps. Let's look at our dental unit waterline treatment and monitoring. So when we're looking at our dental unit waterline treatment, I guess we could say that there has also been a misconception that the water is the problem. So we'll often get that, Nicole and I, when we go into offices, and we do offer an actual dental unit waterline presentation for your office. If you don't want us physically present in your office, we can certainly set it up so that we do it through Zoom. So that's certainly available, that we can give you that education. So when we look at a whole complete system, we have what you will use to clean your lines, and that would be an enzymatic cleaner. We have different bottles allocated to the different chemicals, which certainly makes sense. Once you've cleaned your lines, you would use the cleaner, and then you would flush with water and always finish off with a water portion, I guess we could say. Next, you would move on to your disinfection, and we use Aquafex as it has a parasitic acid base that is environmentally friendly. And again, it has its own bottle. And I believe that for the testing, there's different options again, right? And for the testing part, that's where it also gets a little bit confusing, because sometimes we think that we just need to do the cleaning, the shocking, and we're done. But you need to find out what you did for the cleaning and shocking. Was it actually successful, right? So we've got a couple options. I'll let Nicole take over what the options are, because
we have two options. The first one is a test tubes kit that can be sent to your office. You take samples yourself, or I can come and take samples on your behalf. We bring it back to our maxill lab and we test it here. With having said that, I'll be honest, if an office is out 2 or 3 hours with this humidity right now, it could alter the effects with the in transportation. We do have coolers and things like that, but with the high humidity, it makes it a little bit tricky sometimes to make sure that the testing is accurate. So what I really recommend right now is to do the incubator in office, where you buy the incubator and you do the dip slides in practice. It's kind of like the same idea of you doing your biological incubators, but just on a different scale with being water. It's more effective for you. It's your incubator then, and you can do it at your time and your convenience versus trying to arrange through Maxill's lab, which is still great. It's just a little bit tricky now with the high humidity.
And it's a nice system because it is a start to finish system. And just like any new system, it takes time to learn it. It's actually quite simple. It doesn't take long.
No.
And then, as Nicole was saying, once you have it in your office, you've got complete control. So should you wish to do an extra test on a chair, if you're wanting to test more frequently, you have that option, right? So there's no barrier to that.
And again, we have all the logs for you to log your clean and disinfect, and then to log your testing results for colical forming units as well.
Perfect. And then for the logs, yes, I believe that they are accessible when you head right over to, if you were to navigate, click on any of these, that'll bring you directly to the logs. And the logs are very precise, where you are labeling which room you are testing, which room you're cleaning, which room you're shocking. So it actually does allow you to navigate the rooms and have it all in one area. Next, we are going to move on to the IPAC Support. That keeps Nicole very busy. And basically, we have come up with something called IPAC in a box. It's all in the box.
It's everything that you need.
Yeah. Perfect. So we're wanting to help with the compliance, as we've said earlier. And what would you have? So what's available in all that information? Well, we have an on-site IPAC review. We do have a comprehensive self-evaluation tool that we use. There's a video for training. And in the IPAC in a box, you also have a credit of $500 for product. Now you can have a tailored IPAC manual with IPAC 360. We talked about the manufacturer's instructions for use for a whole library. We will keep you updated. So basically, Nicole and I breathe IPAC, and we will alert one another. Did you see this? Did you see this? So we would be sharing all that latest information. The hotline that's available, the IPAC manual update. So if you are part of the IPAC Platinum, you will get the manual updates as well, and a quarterly newsletter. So if we were to visualize them, that's kind of what it looks like when you're navigating the website for IPAC in a box, IPAC 360, and IPAC Platinum. As you go on to each, then you're going to get a little bit more information as to what each one of those offers. And once again, we can't stress how important it is to have these services, but have them tailored.
Right. specific to your office, not just a general one, but it's specific to your office, your needs, your product, your policies and procedures, your staff, your immunization, everything pertaining specific to your practice.
Absolutely. And I think what also maybe sparked this whole system is we would get a lot of phone calls asking, could we have or could we provide an IPAC manual? So offices would have wanted to be handed an IPAC manual. We wish, right? Yeah. But yeah, they can't be generic, right? Every office has something that's different, right? And then it navigates you through as well different areas of maybe what you could look for. There's the reveal kit we were talking about, and then onto each one of them as well to navigate through and see what they offer. So it's a nice rounded program that you will have the peace of mind. If we could call it, yes, it'll offer you your written policies, but it'll offer you peace of mind, right?
It gives you complete compliance now for IPAC that you've crossed all your T's and dotted your I's.
Absolutely. And I think that makes the big difference for knowing that should there be any type of audit. So it doesn't have to be public health. It could be regulatory bodies. If there's anybody joining us from the US, well, it could be also any state compliance, and you have that information there and ready to go. And it is nice when you flip through your manual and somebody needs information and it's right there. The other thing that Nicole and I always tell offices is that it can also become your training manual.
Can be.
So somebody walking new into the office, or even ourselves when we're working together and thinking, okay, well, what was I supposed to do? If my dental unit water lines are not getting the testing results, what's my next step? So we can't be expected to memorize the whole IPAC manual, but we can always go back and refer to it, right? So I think that takes the guesswork out, and it supports, obviously, that piece of the puzzle that we may need to complete that information. Wonderful. And now if we go back over here, we can drop down the menu to IPAC. We've got, again, IPAC compliance products, IPAC resources, Maxill University. You will find some in-office CEs that are available. And again, we can still do them social distance. We can Zoom with you. Our Maxill CE events, which not many live ones now, but we are planning to have the equipment maintenance, the new periodontal system, the new AAP periodontal system, and should you need workplace health and safety training, complete lineup of health and safety courses are there. Obviously, then you can navigate through. We also have wonderful educational videos that's certainly worth showing to know how to use things, right? Yeah. So you could certainly look at these. You could obviously connect with us, and Nicole or I could come into your office and actually do some hands-on. But because of some of the social distancing, these videos have been wonderful for that, right? So now we'll go back to our IPAC compliance, and I believe that wraps up what we needed to share with you. And should you have any questions, please do not hesitate, and you can connect with us, 1-800 number, ask for one of us, go directly to the live chat. Yeah, absolutely. So we wanted to thank you for being, yes, loyal customers, and we know the growing pains of the changes that are unfolding, and we're here to support you.
Thank you. Stay safe. We did it.